Um, I did want to, as always, remind you of the Arch resource page where you can find most of the resources we're going to be talking about today. Every week I'm adding new resources for you to take a look at. I also pulled all of the resources that were specific to or have as their audience family caregivers and put them on a separate page. So that if you wanted to refer your family caregivers that you're assisting just to resources that were for them, it would be easier to find. So that's the link there. And again, you'll be getting these slides after the call. You can also find that particular page on information for caregivers under the menu item on the Arch page under consumer information. And then I also threw in there the link from the supplement to Arch Quick News update for May that was dedicated to some additional resources since our last call that I thought were particularly noteworthy and you might want to take a look at. In terms of upcoming other activities, I did learn about a community caregiver survey around COVID-19 that's being conducted by the National Research and Training Center on Family Support at the University of Pittsburgh. It is for family caregivers primarily, but it's collecting some data on employment, financial well-being, health behaviors, and mental health, and I think we'll provide some additional information to help us serve those families. And the Research and Training Center plans to use those responses to help develop new interventions to help people deal with the current crisis. And that's the link if you want to share that with your networks. And then I also wanted to share a webinar next week on supporting grand families during the pandemic that's being held by Generations United and N4A, the National Association on Area Agencies on Aging. And it sounds like it's going to be a call very similar to what we're doing here, trying to collect information about how local agencies are responding to serving relative caregivers in particular. And I don't think it's just directed toward area agencies on aging. I'm sure all of you are welcome to participate and learn about other local responses to serving grandparents and other relative caregivers in particular. And then again, just some new and updated national resources that I thought might be of particular interest to you. One is an archived webinar on that was held about 2 weeks ago on supporting family caregivers of older adults around social isolation and loneliness. And it had some very compelling information that was provided. So I thought you might want to, if you in your spare time, have a chance to listen to that webinar. There's the link. I also found, and many of you may have seen this from Torchlight, a toolkit that's designed specifically for employers to better serve their employed caregivers. So I thought that there were some really useful resources for employers in there, and those of you who continue to partner with and work with employers through your lifespan respite grants or just in your general delivery of respite services might find this toolkit particularly useful in reaching out to employers and helping them serve the caregiving population. And then finally, some issues around respite provider and workforce issues. And I'm hoping we're going to talk a little bit about this during our discussion today. But there was a new policy paper that was developed by the Community Living Policy Center at Brandeis University. That's primarily a policy document, but it also lays out some very specific actions that states and others can take to protect workers, whether they're respite providers or any other direct service workers in the community. And what we need to do as a larger community to help make sure that government and other agencies are protecting the workers that are on the front lines of assisting our caregivers every day. And then finally, I wanted to focus just for a couple of minutes on a new national COVID-ready caregiver certification. And this was brought to my attention by the Colorado Respite Coalition, Megan Kluth in particular. So thank you, Megan. This particular certification is available after an individual completes an online training course. And the course goes over the basics, starting with how the coronavirus started, how it's contracted, and then moves into very specific information about how the caregiver, whether they're paid or family caregivers, can protect themselves and those that they're caring for. And it seems to be a very valuable basic training, again, for respite workers as well as for family caregivers. And we did a little fact checking about the certification, and we confirmed that the training was developed in consultation with two widely recognized national groups who support facility-based and home care workers, Leading Age and the National Domestic Workers Alliance. And several state agencies have also started disseminating information about how to become COVID-ready certified. And I just, in talking with Lori Stahlbaum, our federal project officer at ACL, she has let me know that if you would like to purchase seats for providers and family caregivers in your networks, that would be an allowable use of lifespan respite grant funds. And through this Friday, the training is only $10 a person. And then it goes up to $39 a seat unless they decide to extend the discount, and they have extended it a couple of times, but this may be the last opportunity. In either case, whether it's at the $10 a seat or $39 a seat, you may use your lifespan respite funds for this purpose. And I'm also very happy to announce that ARCH has purchased a limited number of these seats for our network so that we can make them available at no charge. We will, because we do have limited number, we will prioritize the awarding of scholarships for these seats to states that do not currently have lifespan respite grants, or states that are not able to use their lifespan funds or other funds to provide the training, and also to respite providers and caregivers who are members of the ARCH network and don't have any other means to pay for the training. So we're really excited to be able to offer that. At first, we will have to limit the number available per state to 5 to make sure that we can reach as many states as possible. And if we have remaining seats after a couple of weeks, we'll revisit your state if you have additional individuals who are interested. And we're going to have to be very careful about sharing the code for those seats, again, because we have a limited number. So we will provide the code directly to individuals who contact us, or if you provide their names and email addresses to us, we'll send them the code directly. And if you are in a state that has a lifespan respite grant, just provide a quick explanation, a sentence or two of why you're not able to use your own lifespan respite funds for this purpose. Again, we ask that you don't share the code widely because we want to maintain a fair distribution of the free slots. And then finally, there's no timeline by which someone may take the training. So even though there's a little bit of a rush to perhaps purchase seats to get that discount, there's no rush in when people have to go through the training and become certified. Does anybody, I'll send out an email about this too, with all of the steps and the details of how to send me your, if you're interested, and send me any names and contact information. Are there any questions about that?
Jill?
Yes.
This is Lori from ACL.
Hi, Lori.
I just wanted to state for the recording, that, yes, I'm confirming that current lifespan respite grantees without approval from ACL are certainly welcome to use their lifespan respite funds to purchase training seats if they desire.
Thank you for that clarification, Lori. That's very helpful.
I just wanted to restate what you stated so that you know we're all on the same page.
Okay, good. Thanks.
Thank you. Bye. I mean, not bye. Muting.
Any other questions? Okay, well, just let me know if you're interested. I hope you are. I think we're going to, as we move into the next discussion, I think you're going to see how relevant this is to this discussion we're going to have today that will really focus on how can we reopen respite or move ahead with providing respite services safely while at the same time assuring family caregivers that these services are safe. And that involves, I think, making sure that we have the workforce to provide that care moving forward, to make sure that they also feel comfortable about working with other individuals who may be high risk, and how this particular training and other training might be really a critical part of how we move forward in these new times during and post pandemic. And I really, again, I want to thank Megan. Megan and I have been chatting a little bit about some of these issues, and she was going to help us kind of frame our discussion today by talking a little bit about, in her own words, about what she sees some of these issues are as we move forward into the next weeks and months around providing respite. So Megan, I'll turn it over to you if that's okay.
Yes, thank you. Hello, everyone. Hope you're doing well. So you reached out to Jill and we chatted after our last call because I imagine what we're hearing across Colorado is probably what you guys are hearing in your communities. And one common theme has been, I think beyond respite, we're all looking for how to kind of get through this and what the guidance is. And I think particularly with respite services, there's just added challenges around how to develop guidance and share it so that services can start reopening, or if they've been continuing to build that trust with families. And so I know here a lot of providers, like everywhere, are getting the guidance from state and local health departments, but I think there's a lot of issues with that, and sometimes it's that they work in multiple counties, and here we've had, different counties have had different rules, so that's confusing. And then I think also, as Jill said, we work with higher risk populations, and so I think there's been some guidance kind of around sort of how this works for the average population, but that may or may not be enough for whoever we're serving. And so Jill and I talked, and certainly there's no one size fits all approach to this, but I did want to kind of open the conversation today around, even if we're not all using exactly the same language and need to modify it based on what's happening where we are, I think there just is a desire for a little bit more consistency and how we can learn from what people are dealing with, since we're all facing similar issues around the country. And so I know we're going to hear an example from Sherry about what they're doing in Indiana, which I think will be very helpful, and then open the conversation more broadly into, have you seen guidance that's been really helpful? I know in Colorado we've seen guidance more specifically around in-home care, and so I think it'll be kind of looking for center-based care. What does that look like? And are there elements? I think we all know respite is it's kind of a tricky service to fit in, and it kind of sometimes gets lost among other service categories. And so are there other services or other industries that we can look to kind of find models that may be helpful, not only for supporting providers as they start opening their doors or expanding their service, but as Jill said, also, I think families are really looking for clear questions that they should be asking providers before they enter their home or before they return to services. And I think just the expectation is, we kind of are all hoping somebody else knows what to do. And I think it's just a challenging situation. So My hope for today is that we can kind of hear, hopefully positive examples of if guidance has come out in your area, or if there's language that you found to be really helpful with, actually with individual providers and helping them feel supported and safe, as well as families. And if not, what the gap areas are, and is there something that we as a network can do to kind of, help address that in some capacity. And, I think as Jill alluded to, we all knew through a lot of workforce challenges for respite provider and direct care provision prior to this pandemic. And I think it's very top of mind for a lot of people about kind of what may happen through this pandemic and beyond. And so looking at how do we make sure that providers as well as families are feeling like things are being done as safe as possibly. And also I think it's really important to acknowledge there's a huge physical and emotional toll that this is taking on all of us, and that may be increasing as services start to open and people start building more comfort. So really just wanted to spend the rest of our time, or a good chunk of our time, kind of talking about all of those issues, and if there's anything that you're seeing that's working well or you feel like could work well, just kind of how we can learn from each other. So I know I'm excited to hear from Sherry and Indiana to find out what their plans for reopening are. And Jill, I don't know if we're handing it directly to Sherry.
I am going to turn it over to Sherry Kaiser, who's with Agape in Bern, Indiana. They have recently reopened their respite home services, and I'm going to let her talk about how they did that, how they came to those decisions to do it, and how they're doing it safely. But I did also want to follow up on what Megan just said, in that Arch will be exploring the development of some kind of uniform set of guidelines around respite specifically. The safe opening, the issues around provider safety, and trying to develop guidelines that will hopefully will be relevant across different respite models. It's not going to be an easy task, but I think I agree with Megan that it would be extremely helpful to all of you if we could develop something like that. That was also flexible enough so that you could adapt it for use in your own states and make sure that it aligns with any county or state or other regulations that you have pending in your state, but something that would be official from the respite network and specifically talk about respite workers, because as Megan said, there's lots of information out there from CDC, from public health departments, but to have something that really addresses respite specifically, I think would be really helpful for all of us. And as we move forward in exploring the development of those guidelines, I'm hoping that maybe we can form a little work group from some of you that might be interested in working on this to make sure that we're going down the right path and that we're not missing any issues. So if you want to let me know in the chat box if you'd be interested in working on a little work group, or send me an email afterwards about doing that. We'll try to get started in the next couple of weeks around developing those guidelines. And we'll be working with some experts in the field as well from our end to help us do that. But I will move it over to Sherry, and then we'll open it up to discussion about what you all think about some of this and what some of the issues are for all of you. So Sherry, if you're with us, I'm going to turn it over to you.
Hello, everyone. Thanks for having me, Jill. When our state went into shelter in place, we were actually still considered essential workers, so we really could have remained working. However, we didn't feel prepared quite for what was to come in the future. So we decided to close down the day after Easter. One, because we weren't sure people were actually going to shelter in place and how many people would have been exposed. So we were kind of thinking we could shut down for a couple of weeks to do that 14-day duration of the incubation period, and then hopefully reopen on May 4th. Well, then our governor was to speak on May 1st, Friday, May 1st. And so we kind of waited to see what he had to say. And we're kind of doing a 5-phase rollout as far as opening things back up. So we're kind of going along the governor's guidelines and also the CDC and what our beads department here in Indiana are saying and doing. During the 3 weeks, we actually didn't reopen until Monday, May 11th, this past Monday. So during those 3 weeks, we were able to contact families. I got some education in place for staff. We needed more PPE, so we took those 3 weeks to stock up. As here in our state, and I'm sure it is in your state too, you can only buy one item at a time in the grocery stores. So we were doing those things in preparation, and I was staying in contact with my board of directors. So I started evaluating the counties around us and the counties that we serve. And we're only serving 30 families out of the 54 this year that are registered for our services. And several of them aren't coming from surrounding counties. Our area has been very low. Thankfully, our county has only had 8 confirmed cases and 1 death. Surrounding counties around us are a little bit higher. So we're taking all of that into consideration with this reopen, and families are being screened prior to scheduling a stay. We are out of home respite, so individuals come to us, which was another reason why I wanted to evaluate that before we remained serving individuals. So with our reopening, we did require some new protocols with our staff and also for the families we're serving. We're now requiring our DSPs to wear masks during all working hours. We're having them take their temperatures and their guest temperatures daily upon arrival. We're trying to refrain, we've asked families and our staff to refrain from congregating with individuals outside of their families as much as possible. Staff have been educated not to report to work if they have symptoms of a sore throat, cough, shortness of breath, headache, or fever. Also, if any family member within their household has had any of those symptoms, they need to call me first to discuss. Staff are required to be at least fever-free for 3 days without medication before they would be considered to pick up a shift. We are making it to where we can minimize the traffic in our out-of-home respite house. So if a guest is coming and they're not getting medications during their stay, we're having our DSPs go outside and bring the guest in with them instead of having family members come in. If they are getting medications while they're here, we are allowing one parent or guardian to come in with the individual and to go over that med list and to make sure that everything's in place for the stay. We are asking family members to wear masks as well. We have not required our guests that come and stay with us to wear masks. However, we are trying to abide by the 6-foot social distancing when they're here. We don't have any more than 10 people in our house at a time, just so that social distancing is possible. We have 4 bedrooms, 7 beds, but we're not rooming individuals together. What else are we doing? We're having them just report to us if anyone in their family too has had any illness before they come for their stay. Outside of that, I mean, we've really just put standard precautions on steroids, wiping things down in the house constantly, hand washing the 20 seconds, even, I mean, as much as ink pens, sharing ink pens, making sure that we're sanitizing everything, doorknobs, just all the things you wouldn't think of, the toilet handle, those types of things. So I do have a checklist for the house to be completely wiped down twice a day, but staff are being very diligent on making sure that as they're going along, wiping down surfaces and spraying Lysol and sanitizing toys that are utilized and those types of things, just being very diligent. I am keeping a track sheet of like everybody's temperatures, and anyone with a temperature 100 or above are supposed to report to me. There was some hesitation in reopening, but I think with all the guidelines that are in place from the CDC and just kind of following what the governor is telling us to do and just watching the numbers, I mean, we could go backwards if we end up having more confirmed cases and the death toll increases, or we would have a positive case here at Agape. We would not hesitate to close our doors again because we definitely want to put safety above all things. But I also know what a great need respite is for these families that we serve. Does anyone have any questions?
Sherry, this is Jill. Would you mind just sharing with us the populations that you serve?
As far as what do you mean, Jill? I'm sorry.
The care recipients, are they all ages, all disabilities?
Oh yeah, they're all lifespan, all disabilities. However, I think the oldest individual that we serve right now is in his 50s. Does have a diagnosis of Down syndrome. So we have alerted families through letters that if they have underlying health conditions as far as heart disease or diabetes, you know, to really take those things into consideration before they would schedule. And I also like the letters that we sent out to the families. I put if they were unsure if their loved one falls into the high risk category, they're welcome to call me. I'm the director here, but I'm also a registered nurse, so I try to walk them through those things. We don't have any elderly coming now, so that's a good thing. The youngest we have coming right now is 7.
Okay. Do you also do in-home respite, or is it just the respite house right now?
We do have 2 families currently that we are serving in home. The one family, it is the grandparents that are the DSPs for the individuals. And the other one, well, she is older. She doesn't come here, but she has her own home and her family takes care of her, and we are in there 7 days a week. So we've put the same type of protocols in place in her house.
Yeah, that was going to be my question. If you're using the same safety protocols for in-home as your, and have you?
There's minimal of our DSPs that go to that house. So out of our 20, I think 5 are trained to go there, and we try to use the same DSPs as much as possible.
And have you, with your DSPs, have you instituted any kind of formal training around how to use PPE successfully and do additional tasks that maybe they didn't have to do before?
Yeah, I just pushed a PowerPoint out to them regarding standard precautions, OSHA, aseptic technique, biohazard, those types of things, including what our new protocol is. And then our office manager, Jennifer, also made a video of the temperature station and walked them through, like, when they first came back, how we were going to be doing things. So we've been in constant contact with them via text message, email, letters, cards, and the PowerPoint, and then they had to do a test and have it back to me before they were able to pick up a shift.
Great. Thank you so much, Sherry, for sharing all that information. Do you have, you mentioned a checklist. Would you be willing to share that with us, and any other written protocol that you have, and maybe those PowerPoints that you just mentioned?
Yeah.
Are those things you'd be willing to share?
Sure.
That would be wonderful. Anyone have any questions for Sherry?
Sherry, this is Megan. I have a couple questions, and I don't know if how much of this has come up yet, but I guess 2 different questions. One is, have you experienced, or do you have a plan for if you have kind of resistance to some of your protocols, particularly around masks and temperature checks and anything like that with either families or clients? Or I've also heard a lot of people talking about like sensory concerns and just, you know, trying to, and as well as, you know, if somebody's getting respite for a certain number of hours, and like if they eat and then needing to change the mask and things like that. So I'm just wondering if you can speak to any discussions you've had around those issues.
Well, we've only been reopened for 3 days, and so far I haven't seen any resistance to wearing the mask. I mean, of course, Staff aren't super excited about it, but it's what we need to do for the safety of our guests. We are having some sensory problems around individuals that have a diagnosis of autism, just because the masks kind of throw them off. So we did have one gentleman that wasn't able to stay. So I did contact mom and asked if there was any exercises that we could do, if they could come over and we could try to help desensitize him to the looks of the mask. But she kind of was trying to do that at home herself and just told me to let her know when those protocols fall off here. I try to work with the families as much as I can, because I just know for some of these families, this time away and to recoup is so important. Resistance as far as individuals doing the protocol, I mean, I'm taking it seriously. So, I mean, I would probably give a verbal warning the first time and then they just wouldn't be able to pick up shifts, because I think it's just so important that we're following these guidelines. This isn't going away anytime fast or anytime soon. Did that answer your question?
Yes, it did. Yeah. And I've heard people kind of wondering about, you know, I think it's one thing if there's one or two cases of kind of the resistance either on the, I mean, I guess on the part of anybody, but just curious if, you know, what people, you know, how people, I guess, are preparing for that to potentially happen. So that's very helpful.
Are there
Any other questions? Well, I want to thank Sherry very much. Agape has been recognized by ARCH as an innovative and exemplary respite service. So we're particularly grateful for her willingness to share this information today. She's really ahead of the curve. Are there any of you others out there who have continued to provide respite or are considering reopening that have put some particular guidance, developed some particular written guidance that you might want to share with us now or tell us about?
Jill, this is Dr. Anderson. I'm in Arkansas. I have a statement kind of question to ask you. It doesn't have to do with any, you know, opening of a respite. I actually run the Arkansas Silk Statewide Independent Living Council, and I'm on our coalition here. But what I was going to ask, you know that the HEROES Act dropped yesterday, about 1,800 pages. Our policy analyst on the National Council for Independent Living is sending us sections to review. Although it's not approved all the way, they're anticipating that they will go to the president's desk. Have you received a copy of that? And if so, have you looked to see if there's any funding that is proposed as it relates to for the aging population?
I did receive a copy of the bill yesterday.
It's massive.
So I have not read all 1,800 pages yet.
Wow. Well, you can't.
I do know in one of the past stimulus bills, there was an additional $100 million for the National Family Caregiver Support Program. That's gone out to area agencies on aging to provide more respite and caregiver support. There was also additional funding for aging and disability resource centers.
I'm good. How about you?
If you wouldn't mind, please.
So would you learn or would you encounter?
Let me see if I can mute these people. Okay, I think I did. All right. So the Aging and Disability Resource Center funding went out a while ago as well, and to some degree, as you know, the Aging and Disability Resource Center's No Wrong Door systems do support family caregivers and have some of this emergency funding to put toward those services. In terms of the bill that came out yesterday, I know there's additional funding for the Child Abuse Prevention and
Right.
Treatment Act, including Title II, the Community-Based Child Abuse Prevention Program, in which Respite is a core prevention service. So if the state is already using those child abuse prevention funds for Respite, they may have a little more opportunity to do so now with some additional funds. I know there was also language around home and community-based
Yes,
services,
yes,
additional
yes.
funding for that, so we're very excited about that.
Right.
So again, while I haven't had a chance to analyze all of it, I do work very closely with the disability and aging communities here in DC, and we'll be seeing more specifically what's included in the bill. Unfortunately, in the Senate side, they're not quite as supportive of everything that's in the House bill, so I don't know how likely it is that most of this will move forward, but we're certainly hopeful.
Well, you know, and certainly one of the things that I found in Arkansas, of course, I did some of the negotiations and the scoring for the last round for some respite before COVID hit, and we didn't get a lot of applications. So once we can get to a baseline, one of the things that I'd like to help our director that's in aging is just to get it promoted. I really believe that a lot of people maybe don't know that it's expanded for, you know, like even more for children. I really think so. If we could just probably follow some benchmarks or some other states on how they're getting that information out there, I think it would help us here in Arkansas. So, but we have someone that does a great job with Respite, but you know, we just didn't get a lot of applications.
Well, I think, you know, there's still a lot of hesitancy among family caregivers to use Respite or allow individuals to come into their home. And so at least for the Medicaid population, there have been many approved Appendix K amendments to home and community-based waivers that are allowing family caregivers to be paid to provide services, as well as allowing other members of the family to be paid as respite providers. So, you know, it would be nice if we could extend those same flexibilities to those outside the Medicaid population as well.
Yeah, that would be awesome. Yeah, thank you so much.
My guess is that it would be nice to know if area agencies on aging were opening up flexibilities with family caregiver support dollars the same way. That's, you know, and I know I think they're considering doing that, but I don't know the extent to which that might be happening.
Right. Thank you.
Mm-hmm. Anybody else have other information about that? The use of any of these new federal dollars that have come down to states through family caregiver support or through ADRCs or other emergency funding that's been made available to states over the last few weeks? Are there some of you out there who provide direct respite services that are still very concerned about opening respite and might share with us what some of your concerns are? And I know there are many, we all have them.
Jill, I think my biggest concern, this is Sherry again from Agape. The fact that we are out of home and we have individuals come from all over the state. So just monitoring that. I don't know how many people on here do out of home respite, but I know that's something I'm really keeping a close eye on. And just not knowing what people are doing outside of being here and who's exposed to who, it's definitely concerning. So definitely think that the protocols are necessary, and as trends change, we may have to put more into place. So that would be my biggest concern.
Yeah, especially with a program such as yours that has such a statewide reach.
Yeah, and you know, in 28 years, I was talking to Bertie Lehman, the founder, and we've never closed our doors before, so that was a first. but it was definitely necessary to prepare to go forward. I would recommend anybody, take that downtime and prepare if they're not already closed, just to get prepared to reopen.
Jill, this is Megan. I can speak to, we have several different respite programs for different populations in our home agencies buildings. And so some of the concerns from those directors are just PPE concerns, which I know Sherry mentioned, and how do you stay on top of that and really estimate that out as accurately as possible. Also, shared spaces. I know that's come up a lot with our buildings of you can, if you have your programs in one building, you can, control that as much as possible, but how do you control if you have common areas like hallways or bathrooms or things like that? And I think another major concern is also just kind of the toll this is going to take on providers, and how can agencies build in particularly mental health support. I think it's just the anxiety is already high, and it's just going to be that much higher. So that's definitely been a concern too, of like, particularly, how do you rotate staff? And in Colorado, we're still under the no gatherings over 10 people. And so if you're running a day program with 50 people, like logistically, what's the best way to have, you have to have at least 2 staff and 8 clients. And so we've heard a lot of conversation around how do you find the right balance so that clients can be kept safe and prioritized, but also ensuring that staff aren't being overloaded with those ratios, as well as just knowing this is not going to be a normal day for them.
Yes, thank you for sharing those. I mean, these are all the kinds of issues that, as we develop guidance, we're really going to have to think carefully about how we address them. So that's just identifying what the issues are would be very helpful to us as we move forward. So that's helpful. Thank you, Megan. And it's not just, for immediate opening, but thinking 2, 3, 4 months down the road, while things may open up a bit, possibly, are there still issues that are concerning that we want to be prepared to address? And I think one of those issues, of course, is what will we do about recruiting new providers who may have left the field because of the anxiety and stress around being on the front lines of the pandemic. As Megan said earlier, we already are facing a direct service worker crisis. So how will we deal with that as we move forward? Will we find the people to provide the care? Anyone want to tackle that big issue?
Jill, this is Tricia. We've talked about different ways to try to be creative during this time, recognizing that people don't want to be out, supporting others. Then there's the amazing stories that you hear that people are, willing to do whatever it takes to support different folks in our communities. So we've looked at different considerations throughout the state on what about retention bonuses or, bonuses in general, and what does that look like, as well as just better understanding some of the federal, the FSCRA Act, and, just trying to get people in the right direction to know that there are resources out there that they can consider. So it's just been trying to be supportive and share resources and reassuring people that there could be alternatives out there that we can try to connect them with. The other thing that I was thinking about too, I was on a statewide call earlier today with different counties throughout the state of Wisconsin. And one of the things that was brought up, we're having a soft opening in our state. And we're recognizing that PPE is already, it's already very, very limited. Some of our concerns are, how are we going to assure that some of our, folks who are on some really, have some really intense cares, that they need these gloves to support folks to stay in their homes or just in general and every day. As small businesses start opening, we know that small businesses have also been ordering the masks and different PPE. So that's going to put an even greater crunch on the already limited resources that we have. So that's something, at least within our state, that has been on our radar. And we're really trying to be creative with how can we be proactive about it so we're not all of a sudden let's admit it, we all feel like we're kind of in crisis right now because nobody expected it and we don't know what to do, but we're doing our best to try to prevent any further crisis mode for all the folks throughout the state. So just thought I'd weigh that in there.
Thank you, Tricia. I think that's a really excellent, some really excellent comments that you made, especially around PPEs. We're already in a tremendous shortage around gloves and masks. And as you said, we're not the only field that's going to be requiring these services. I mean, these materials and resources. And how are we going to address that? I'm hoping some of that was addressed in that 1,800-page supplemental appropriations bill that came out yesterday. I know that the bill does include things, I believe, like hazard pay for direct service workers to make sure that they're financially secure in continuing to provide services. And as we go through that bill, and again, that'll primarily be for Medicaid populations, those who serve Medicaid populations, but hopefully the resources will be made more broadly available as well. But it may not be happening in the near future to the extent that we needed them to be. Any other issues or concerns, or anyone else want to share about what's happening with their own respite program that they've employed to reopen or to continue to provide services? For those of you who do provide direct services, are you thinking about actually reopening anytime in the near future? I should have done a polling question on that. That would have been an interesting thing to find out. I haven't seen anybody enter in the chat box that they might be interested in working in a small work group to help ARCH develop some guidelines, but I remind you of that request again, so think a little bit about it. You don't have to commit today, but if you're interested in working on this, please let us know. If you think it's a bad idea for us to develop some respite guidelines for providing services now and in the near future, let us know that as well. We're open to any and all thoughts about this. And Megan, I'm just wondering, did you have any other questions or thoughts you wanted to raise with the group?
No, I don't think so. I think just, I mean, I would ask if people are able to, if they do see things that or they feel like the language is really helpful, if it's from their, from whatever, approved source, I think that's great. Or just if they're finding things that are helping families feel more comfortable. I think I have heard several people say, I feel like, families maybe need something from a more official source to feel comfortable. So I think as long as we can just, I think we're all, as many people have said, we're all figuring this out as we go. And I think a lot of us are kind of just waiting to see what other groups are doing. So I really do appreciate sharing what's going on there, because I think that's really helpful. But I think if people see things, if there's a way to just kind of continue to facilitate the conversation, we're definitely going to be dealing with this for quite a while.
Yes, thank you, Megan. And I would like to reiterate, if you do have tools or guidance or anything your particular respite program or service has already developed that you'd be willing to share with the group, that would be extremely helpful. And we will post it on the ARCH website with your permission, or just share it with this group. But whatever resources you have, as Megan was saying, any language that you have that talks about providing respite safely, or language or techniques that you're using to work with family caregivers around their respite needs and what kind of respite they'd feel comfortable with moving forward. Just please share that with us so that we can continue to share that with this group. And thank you to there were a few people who did sign up for our work group. So thank you very much. I'm very eager to work with all of you on this issue. I think as we develop something, we can circulate it to all of you for your input as well, so that it reflects different parts of the country and different types of respite models and programs and different populations that you're serving. We do want to be able to capture all of that without being too overly prescriptive or conflicting with any state or local requirements that you may have. And again, these would not be requirements or standards. It would simply be guidance for all of us as we move forward in delivering services. Any other last thoughts or comments? Questions? Well, then I will give you 5 minutes of your afternoon back to all of you. Thank you all again. I'm very heartened to see that there's still tremendous interest in getting together and learning from your colleagues around the country on how they're coping with providing respite and supporting family caregivers during this difficult time. So if there is continued interest, we will continue to hold these calls on a regular basis. And I will let you know via email when the next call is, when I send around information from today's call. Thank you all very much. I really appreciate your time today. Have a great afternoon and be safe. Thank you.